Welcome to Think Like a Pancreas, the podcast, where our goal is to keep you informed, inspired, and a little entertained on all things diabetes. The information contained in this program is based on the experience and opinions of the Integrated Diabetes Services clinical team. Please discuss any changes to your treatment plan with your personal healthcare provider before implementing.
Hey, everybody. My name's Kristi Paguio, and I am a clinical social worker that specializes in diabetes. Today, we're going to talk about the burden of diabetes and self-advocacy. This is a common theme that comes up living with diabetes, and it's the invisible side. It's a very important part of living with diabetes, but we don't get to talk about the burden of what that is enough. So I'm going to let my colleague, Dr. Paula, introduce herself, and then we'll get into it.
Thanks, Kristi, and it's a pleasure to be here with you again today. So my name is Paula Diab, and as Kristi said, I'm a clinician and I work in South Africa, actually. I joined the IDS team about 2 years ago as a diabetes care and education specialist. And my areas of expertise are basically in diabetes and obesity management. So although I see the burden of diabetes self-advocacy perhaps from the other side of the table, I'm hoping that between Kristi and myself today, we can maybe present both sides of the table as clinicians and patients. Yeah, as Kristi said, it's a very invisible problem in diabetes, is this burden of constantly having diabetes, constantly having to fight for your care, your needs, with patients, with clinicians, with in terms of your family, in terms of the people around you, within the healthcare system. So, yeah, we just wanted to put some ideas on the table today and have a discussion around it and see if we can come up with some solutions and make it a little bit less of a burden for people.
When I think about living with as a person that lives with diabetes, I've had type 1 for 25 years this summer, or this past June. This was one of the hardest parts for me being diagnosed with type 1 as an adult, is I was not used to having to advocate for myself in that way, let alone educating, or like everybody knows what diabetes is, but it really felt like, how does nobody know when diabetes got thrust into my life, it felt like nobody knew anything about what I was dealing with. And I could definitely tell that healthcare providers really didn't know. They had big concepts of what it was, but they really didn't know the totality of how that was impacting me. And I had a lot of wounding moments in that gap of what I maybe expected from healthcare professionals, naively so, validly so. And it, I stumbled and struggled for a few years after my diagnosis, really having a love-hate relationship with how I was being talked to. I was just with some of my closest, dearest friends with diabetes a week ago, and one of the things that was said by a dear friend of mine was, she remembers every shitty thing that a healthcare professional has ever said to her about her diabetes. And boy, that really rings true for me too. And so fast forwarding, as a healthcare professional now, advocating for and trying to meet the needs, the emotional and mental needs of people with diabetes, now I'm embedded in these systems and trying to help teams relate differently with their patients, for themselves and for their patients, but looking at the strategies of what works well. And so I'd like this conversation to be not just validating the wounds that can happen while interfacing with, and not just to throw healthcare because there's just so many systems, and whether it's our family systems or pharmacy or insurance, there's so many barriers to this self-managed condition, in air quotes. And man, there's just so much up against us. And so this need to advocate, we just come up against it again and again and again and again. And it sneaks up like at a party or a gathering at a restaurant or at a concert or wherever we might be, that something, whether we're trying to get into an arena and we've got diabetes gear on, what line do we go in and how do we advocate for that?
Yeah, so Kristi, I was just reflecting on what you were saying there about when you first accessed the healthcare system. And I think part of the motivation for me in studying more towards diabetes is because I actually didn't have a very good understanding of the disease and a very good knowledge of how to manage it, even as a qualified clinician. And I went back to my medical school notes and we had 2 pages of notes on diabetes, basically just saying there's type 1, type 2 diabetes. Type 1 needs insulin, type 2 not really. You've got different types of insulin, long-acting, short-acting mixes. You've got tablets for type 2 diabetes. And that was really the basis of what we got told. And I think that for so many people with diabetes, you expect your clinician to be well versed in what's going on. But the reality is that we don't get a lot of training. And that's, I think, internationally, we don't get a lot of training. And so unless you're going to study further in the diabetes field, the clinician, him or herself, is also going to be a little bit on the back foot when you're coming with a complex disease such as diabetes.
A little more self-disclosure. So I was actually diagnosed with hypothyroidism as a child. So I had been seeing an endocrinologist my whole life. And now I didn't know endocrinologists dealt with this diabetes thing. And so when I was going in for my follow-ups, I noticed such a stark difference in how I was talked to. And it was so different than how I had experienced going to the endocrinologist for the first 20 years of my life. And now all of a sudden it felt adversarial in the tone and in the approach. And what I was thinking of with what you were talking about is that there's so many mismatched needs in there. I think that I knew in a sense that, or I didn't know what I didn't know about diabetes. And I knew that I was on insulin and I was grateful for that I had the right diagnosis, although I don't think I could appreciate that. But I think what was missing is I didn't have the empathy and the psychological support for this traumatic diagnosis and impact to my every moment of my day. It was just, here's the regimen, follow it. If you're having a low blood sugar at 3 a.m, have protein. This is the long, but like, and I'm like, who's having protein at 3 o'clock in the morning? Like, anyways, I remember this comment, right? This anxiety that I took as a scolding. I think it was physician anxiety that I took as a scolding, that I was doing something wrong when I was in the honeymoon phase of the diagnosis. So, but I left I didn't know how to advocate. I didn't understand yet how things needed to transform in me. There were just so many different, this was like a part of the diabetes training that isn't talked, at the time was not talked about enough, that I've had to get really versed in. And thinking about, I kind of think about diabetes self-advocacy as I've got my hands on the steering wheel all the time, whether I'm talking with a stranger that happens to see a device on me, or I'm with a family member and they are asking me a question, or seeing that I'm dealing with a blood sugar issue, or I'm at the doctor's office, or I'm dealing with a pharmaceutical company, whatever it would be.
An ongoing struggle all the time.
Yeah, like it's so much more than just what I have to do to manage my diabetes and make sure that I'm rotating my sites and doing all the things. I also there's this whole other red tape that I have to navigate all the time. And how to stay engaged with the system, because I know that my tendency would have been to be like, and I'm out. Like this sucks. This is ridiculous. Insert tears and expletives. And I'm so grateful for the influences in my life, that part of that support system that helped sort of keep me within the stay in the lane of taking care of myself and stay engaged with healthcare professionals. And what we want to talk about today, what I think about is how to validate the wounds, and also what are strategies to stay engaged and how to shift our perspective maybe in a way.
It's interesting, the contrast between hypothyroid or thyroid disease and diabetes as well, because I think thyroid disease is actually quite simple to treat compared to diabetes. And so perhaps it is exactly that. It's that clinician sort of anxiety that the clinician really doesn't feel like they've got their hands on it. Because unless you live with diabetes every day, you're actually not going to have your finger firmly on the pulse and know what's going on with diabetes. One of the things you mentioned, you were sort of talking about the words and the way that you were spoken to. And I think so often, I suppose I've caught myself saying them as well. And you sort of look at a patient's download and you say, I see your sugars are out of range, because that's what I'm seeing on the computer screen. Or I see that the patient hasn't taken their medication, and that in my head, I'm seeing that as being non-compliant or non-adherent. Or you're hearing the patient saying that they haven't been able to take their medication or haven't been able to test themselves as often as they would like to have, or as you asked them to, and they haven't done that. And you interpret that as not sticking to the plan. But unfortunately, all those words and all those ideas that I'm seeing on my side, we've got to be very careful how we express those to patients. I mean, I don't know what's gone on in the patient's life before they come and see me. And you've got to turn those words around and say, I notice that you've been struggling with your diabetes lately, or perhaps even take the word struggling out of it and just say, tell me how things have been going, what's been working, what hasn't been working, and allow the person to say, well, actually, I think I've done a damn fine job the last month. I've tested myself once a day. And if that's what they think is great, then roll with that and work from there.
I love that, Paula. When I think about, I always like to think about, I love what you said about how have things been going? Like, how's your diabetes been going? Or how's things been going? I mean, there are real constraints that healthcare professionals, having worked in that system for 15 years, I know that there are real limitations to the length of time that we have to meet with a patient. And so I think what so often happens is we quickly and efficiently are trying to think of it in a very simple case study of like, what's a synopsis of what's happening? And then what is the intervention that I'm going to do? But what the person brings into that scenario is the other context that's not going to show up in that lab value or in that download, or in their handwritten logs, whatever it looked like, that it does not have the context of the other things that they're dealing with. That's death, that's other illnesses, that's work stressors, that's, loss of relationship, new relation, like there's just so many,
all of that comes into it.
So many other parts of the whole person, right? And I think it's just I think that so often what happens is that the patient and the healthcare professional, there can be friction when really it's just that healthcare systems are not really set up for chronic illness management. They're set up for rashes and sprains and colds, and not for in the trenches of what it is to live with a chronic condition day in and day out, moment after moment, hour after hour. So it's just, it's a vulnerable interaction.
I always say to my patients, like diabetes, you cannot treat it in 15 minutes. And if that's all the healthcare system is giving you, either you've got to learn to work within that 15 minutes, or you've just got to sacrifice an hour and do it in an hour. And even an hour sometimes isn't long enough to really touch base with the person and see what's going on. But I think, I mean, obviously in the private sector, time is money. And so the more time you spend with someone, the more you feel obliged to charge them, or, if you decide to just charge them a flat 15-minute rate, then, you're losing out as a healthcare professional. But from a patient's perspective, I think the real thing is to meet the patient where they're at and to say, what is it that you're wanting from today? What is the burden that you're dealing with? And some visits it might be a clinical burden, some visits it might be a social burden, some visits it might be something completely different.
Word from our sponsor. Byram Healthcare understands that managing diabetes isn't one size fits all. With a full range of CGMs, insulin pumps, and diabetes supplies from top brands, Byram makes it easy to get what you need, hassle-free, shipped right to your door. And Byram's team of experts helps navigate insurance so you can focus on living your best life. Ready for better diabetes care? Visit ByramHealthcare.com/podcast or call 866-692-8024 and select option 3. And now back to our program.
Yeah, the challenges are really real, right? Like, as much as I want and need probably an hour with my healthcare professional, just, like, I know that that's going to their schedules are booked, like, in that the systems put those things in place. So I don't want to be, if that's what they're doing and I'm the 5th patient in, and now my provider is going to be a few hours late to see me. So the logistics are a real challenge. But what I think about is, as a patient, what I recommend to my clients and what I try to do myself is to go in a little bit with a strategy of, one, understanding the dilemma that everybody's in. And so that can be helpful to sort of zoom out and to depersonalize it a little bit, not validate ourselves, but at least to think about, okay, this is the broken structure that we're working in, or the imperfect structure. And how do I really zero in on, and I think having a piece of paper with you often can be really helpful to keep your thoughts organized and bring the attention to the healthcare professional that you've got some strategies and some things that whether it's a prescription list, or it's a device question, or it's a financial issue of asking for a reason. But I think having going in proactive into that appointment is one strong step forward. It doesn't mean it's going to be perfect. And then the other thing that I think of is what would generally happen for me is I would really clam up and get really guarded, waiting and bracing for a negative interaction. And what I've learned to do and try to do is instead engage a little bit better, sort of make a little bit of small talk that sort of get more, that flies with honey or bees with, like, so I try to use that side and bring that out to compensate a little bit for the deficits that we're working in within the systems. And so to kind of lower everybody's anxiety, even though I probably still clam up a little bit, but so I try to think of, and then the only other piece in there is when there's a little bit of a rupture in the interaction, trying to use it as an opportunity to educate a little bit. Diabetes is really hard, and it's multifaceted, and it's just a part of me. It's not all of me. Sometimes I do that better. Sometimes I clam up or just skip, like, this is not the person that I'm going to be able to. But it's some combination of all three of those things, of having a plan, going in to the best that I can think about so I can guide the conversation to meet my needs, try to use a little bit more honey to get, a better interaction. So a little bit of small, how's your day going? Oh gosh, it's almost Friday, blah, blah, blah. And then when there is something a little bit more egregious, using that as an opportunity to say, diabetes is really hard sometimes, and it's a lot more complicated than it can seem from a distance, and to educate.
I also think sometimes, I mean, obviously that the planning for the appointment is critical, but I also think it's quite nice to actually bring an advocate with you to an appointment, whether it's your partner or a parent or a friend or something like that. I always say to people, it's like an extra pair of eyes and ears, and can also be an extra mouth if you need an extra mouth. And even as a competent, mature adult, sometimes we need an extra mouth and eyes and ears. I mean, I've just had the situation where I need to take my car in to be serviced. Like, that brings such anxiety for me because I know nothing about a car, nothing about garages, and I don't like mechanics, and I don't like car servicing. And my husband does all of that for me. And it just sort of takes that huge weight and that burden off me. And if I have to take it in, I sort of texted him the other day and I said, do you mind coming to drop off my car with me? Because, at least you can talk to the mechanic and you can talk boy to boy, and, you can get on with it. And I think a lot of the time with healthcare, that sort of just having another person, another pair of eyes and ears is hugely beneficial.
Yeah, where I know that for me, what I really had to figure out, and this took years for this to sort of synthesize, but building my support system over time of people that, because like early on, my husband didn't like the car thing is a great example of ways that we need somebody to advocate that's a little bit more comfortable, maybe a little bit more removed, and also just strength in numbers, right? But from a diabetes perspective, I was dating my husband at the time, and he was having to get just as up to speed about what this was and kind of get through the cobwebs in his mind about people with diabetes have to take care of them. So to really shift and shape that conversation that I'm the quarterback or I'm the expert of me, even though I'm still learning and understanding. But it really makes me think about how much we have to build up support systems, whether that's emotionally or motivationally or information. Like a car is a great example of that. Like you don't have all that information about, I don't know how to fly a plane. I'm going to trust a pilot to do that.
Exactly.
But boy, when it comes to diabetes, there's just so much to it.
And I think that is the burden of diabetes, is that there is so much to it and there is so much complexity to it. And it's a continuous educational process. You might have lived through diabetes as an adult in your 30s and you're very competent dealing with it, but you haven't been through menopause with diabetes, or you haven't been through a surgery with diabetes, or you haven't been through an emotional trauma with diabetes. And so all of that adds things onto it. And I think that network and that support team around it, whether it's just a friend or a partner or a spouse or an online support group, or just friends that have got your back. If you go to a party or a celebration and someone says, would you like some cake? And you think, well, not actually, because then I've got to do a whole lot of things just to be able to eat a slice of cake. Just to have a friend who says, no, I'm also not going to have some cake today. And then that just dulls down the situation, and it's not as exciting anymore when just one person has said that they don't want it. So I think all of those things can be very helpful just to reduce the burden of diabetes and just to take some of that pressure off, I think.
Yeah, I had a little personal story for me is I had to go into the emergency department a few years ago. And I think I hesitated to go in for quite a while because one, I was sick and probably a little bit compromised in how I was even thinking through what was happening. But part of it was I knew I was going to have to advocate for my diabetes, and I just didn't have it in me. So finally things got to the point where I had to go into the hospital, and I am really grateful that my husband actually advocated and worked with the healthcare team to make it so that I could keep my pump on and I could manage my diabetes. In saying all of that, though, that was my first time being back in the hospital since my diagnosis, some 20 plus years later. And I grieved a different way, the diabetes, that I still had to manage it while I was sick enough to be hospitalized, because although they would have done a good enough job, I know that. I just am so trained to have my hands on the steering wheel. What a challenge when I'm compromised. And so there's going to be times living with diabetes that we have to hand that steering wheel off to healthcare, like in a hospital situation. And a friend of mine that I was talking about, she's just got so much wisdom, that talked about remembering every shitty thing that's ever been said to her. Is she would talk about educating. She would say, educate, ask why they're thinking of doing something a certain way. Educate and share with them how that feels for you, so that there's a little bit more of a partnership. And again, trying to keep those stress levels lower so that you're not tensed up and in that fight or flight, but more in can we open up a conversation so that you don't get labeled as difficult patient, and more of kind of working with their egos and helping them to work with you, which is not fair, but it's just part of the reality of what we have to deal with.
Yep. I think you made a comment in the last podcast we did when we were talking about diabetes being like an ultra marathon and being this long distance event that you've got to continuously struggle with all the challenges. And you coined a phrase, I don't know if it's yours or you got it from somewhere else, a compassionate curiosity. And it really struck a chord with me, because I just think we as healthcare workers can really up our game hugely by learning from our patients and just listening to our patients and just being curious about what their burdens are, what their struggles are. We've spoken about it a bit. You look at the download, and as a healthcare professional, this looks like a bad month that the person's had, but maybe that's actually a really good month, and maybe there were a whole lot of balls in the air that person was really struggling with, and just to be able to get out of it on the other side was a real win for the person. And I think if we can just have a little bit of curiosity about it and just try and inquire as to what the burden is, how can I alleviate some of that burden rather than adding to that burden, which I think quite often healthcare providers actually do.
Yeah, when I think about compassionate curiosity, I use it a lot for my clients that are beating themselves up for whatever they're struggling with, that like, "God, why am I dealing with it? Why do I do it?" And instead to shift it. I love how you're talking about it as a healthcare professional and how to use that in that way. And I think removing the judgment out of it for ourselves, and instead thinking about it like, I wonder what this is about for me. Like, I wonder why I'm feeling so discouraged or fatigued, or and what that does is it just opens it up so that we're in better relationship with ourselves. And then that's going to foster that communication that we can go in advocate in all these different arenas and say, it's like we've made peace with ourselves a little bit, that we understand ourselves, that there's a lot that goes into life, period. Now we'll tack on a self-managed, chronic illness like type 1 diabetes, which is just on a whole other level. Oh, and we often make it look so invisible. It's like, how do we befriend ourselves in that way? Take that picture off so that it eases our communication with ourselves, with family members, with friends, with the systems, with the providers. I love how you're talking for healthcare providers, but really for ourselves too.
Yeah.
It's extraordinary what we do, even though it's so easy to look at all of the mistakes or outside of range or missed this or that. Like it is
okay to be out of range for a bit.
Extraordinary what we do to be a pancreas. And this is the mindset shift. Like, we're incredible. We just have to own it ourselves. And so acknowledge that it's insane what we're tasked with, but yet how can I let other people know and bring them in so that, and allow myself to rest, allow myself to acknowledge that I'm carrying more than somebody that's not living. I mean, not comparing against anybody else, but just being a pancreas is an extraordinary job.
Yeah. And sometimes you can take a break from diabetes. Maybe you decide, you know what, I'm actually going to go a bit out of range, and I'm, obviously within limits and within safety aspects. But maybe I just don't really feel like paying too much attention to it. Or as you were describing earlier, you weren't ready to go and access the healthcare that you needed because you knew that you had to deal with your diabetes, and you had to, you weren't ready to give away the steering wheel, as you describe it. And maybe it's okay to not collect your medication today and to go tomorrow. Or maybe it's okay to delay the blood test that you need for a week until you feel ready to go in and explain why you've got.
Or maybe pass the baton to somebody else and say, would you go get my script? Or would you
100%.
help me? Or I'm just not going to pay attention for, I'm going to just focus on how my body feels and not as much on pacing blood sugar numbers that is so easy for us to fall into.
Can you just maybe phone the doctor and make the appointment for me because, I don't have the capacity to do it, and just alleviating that burden slightly. And then I think, as you said in the beginning, just advocating for yourself when you go and see the doctor and being upfront with the doctor and just saying, listen, the last month has been terrible. I haven't done what I know I need to do, and I know I need to get back on track. I'm dealing with a couple of balls at the moment. And, I'll get there. I just need a little bit of compassion and time to get there.
Well, or maybe what it is like that my blood sugars don't reflect like the extraordinary challenges that I've been like jumping all these hurdles, and it's not going to be captured on some silly graph. So it's more about, I'd like to tell you about sort of the context of which all of this has been happening so that they see us and not just get focused on data for so much longer. This was great chatting with you about this, Paula.
Thank you, Kristi. It's certainly a very complex disease, and I think both from a provider and a patient's perspective. And I think the bottom line is that we actually just need to be more compassionate of each other and more understanding of each other, and seek to maybe alleviate that burden rather than adding to the burden of diabetes. We know that there's a massive burden of diabetes from a healthcare sector point of view, from an industry point of view, from a public point of view, from a daily life point of view. And if we as a diabetes community can just sort of be a bit more compassionate and empathetic and just relieve other people's burden a little bit, I think it's not about curing the disease. It's not about making it better all the time. It's just about
Coming alongside them.
Absolutely.
What I was thinking about too is along those lines as we wrap up is build up that support system like we talked about before, and find your tribe, find your people. And integrated diabetes services is a great way to find people that understand this, that are educating themselves, that do, that this is their specialty. There's a wealth of resources there, whether it's meeting with a clinician or tapping into some of the other educational programs of people that live with diabetes. Empower yourself. Go build your support system.
Yeah. And I think just in closing, just to say thank you, Kristi, because it's always so great to learn from you and to interact with you. And I think the more podcasts like this we have, hopefully the more people will be able to just touch base with us and to see these are real struggles that we have. And maybe we don't have the solutions, but we can certainly try and help get the solutions. So thank you.
You're welcome, Paula. It's always great to be with you too.
Thanks for tuning in to Think Like a Pancreas, the podcast. If you enjoyed today's episode, don't forget to like, follow, or subscribe on your favorite podcast app. Think Like a Pancreas, the podcast is brought to you by Integrated Diabetes Services, where experience meets expertise, passion meets compassion, and diabetes care is personal because we live it too. Our team of clinicians, all living with type 1 diabetes, understands the challenges firsthand. We're here to help no matter where you are in the world. From glucose management to self-care strategies, the latest tech, sports and exercise, weight loss, type 1 pregnancy, and emotional well-being, we've got you covered. We offer consultations in English and Spanish via phone, video chat, email, and text. Want to learn more? Visit integrateddiabetes.com or email info@integrateddiabetes.com to schedule a consultation. On behalf of Think Like a Pancreas, the podcast, I'm Gary Shiner, wishing you a fantastic week ahead. And don't forget to think like a pancreas.